If these numbers are true, it's absolutely atrocious.
Medicare's in very bad shape. It is hemorrhaging.
And compliance expert Dr Margaret Foe believes it's being bled dry by a combination of honest mistakes and outright rorting, running the gamut from needless referrals and irregular billing practices through to more serious allegations such as dead patients being billed for consultations and patients with known substance abuse issues being prescribed drugs of addiction. At the heart of the issue, an alarming lack of oversight.
Medicare was built on an honest system. With your first name, last name and your date of birth, I can go and get your Medicare number and I can bulk bill something and you will never know, and neither will the government.
The AMA today rejected Dr Foe's figures outright.
These are fantasy figures. If there is any story at all, it's that we've got to modernise Medicare and we've got to take all the waste out of the system.
Going on to defend the integrity of its members.
999 doctors out of 1,000 do the right thing, work hard, and that's why we're so angry about these ridiculous stories that have no basis in fact at all.
The government, meanwhile, pledged to take action.
We do need to do more work here to make sure that our defences against people who want to rort and thieve from government programs are cracked down on. And so we will do that work.
So just how sick is our health system?
Every Australian is saying, I can't find a bulk billing GP. When I go to the hospital, I don't get in to see anyone at the public hospital. Ambulances are ramping. There are signs of real system collapse, and every Australian can feel that.
The AMA has been extremely strong today, saying that there is no basis in any of this. Now, clearly there's been, when there's a pot of government money, some people will find a way to get their hands on it, honestly or dishonestly. But I don't think it doesn't appear to be a widespread problem.
But part of the argument, right, is that the Medicare system, the way it functions, is quite old.
Yes.
It wasn't really set up for this digital age, the fast cycling through of patients. It was from back in the day when you maybe had one GP.
But I think what the doctors are saying is we've been through 2 years of COVID. We're all exhausted. Why are you now having a crack at us about something that most of us are not doing, if any of us? The AMA, I've never heard the AMA that strong. He called these claims rubbish.
Yeah, the big gulf between what he's saying and what the reporting suggests. 8 billion is a lot of money.